Whoever invented the C-section was a genius. It only lasts 30 to 60 minutes, but because of this technique, millions of babies and pregnant women have been saved from death due to obstructed labor. The degree of danger is self-evident. So how exactly does it remove the fetus? Today, we will show you the whole process of C-section surgery in 3D animation. Before the operation, the doctor will do a thorough examination of the mother. The doctor will determine whether or not the mother should have a C-section. It is worth noting that Cesarian section is usually necessary in cases of obstructed labor, overseized fetus, pelvic tumors, etc. When you and your family finally decide to have a Cesarian section, the doctor will perform another ultrasound on the mother-to-be. This will help you know exactly where your baby is in your tummy so that you can avoid accidents as much as possible. The nurse will then bring in a catheter and vascular catheter to insert into the mother's body to drain the urine from the bladder. This prevents the urine from enlarging the bladder. Before the operation, the doctor will use a curtain to separate the head from the body so that the mother-to-be will not be affected by seeing the operation. Next, the doctor will use a different type of anesthesia for the mother's condition. Generally speaking, there are mainly local anesthesia and general anesthesia. However, general anesthesia may come with certain risks because you are completely unconscious during the process. In addition, it is very likely that the baby will come into contact with the medication, which may affect the baby's physical condition. Usually, local anesthesia is the most commonly used without special circumstances. Not only does it minimize the effects of the procedure on the baby, but it also prevents the baby from coming into contact with the medication. However, during the operation, you will not feel any pain, but you will be conscious. The doctor will then inject the anesthetic into the lumbar vertebral space. After all the above steps are completed, the doctor will cover the mother-to-be with a special surgical cloth. The doctor will apply an antiseptic solution to the incision site. Next, the doctor will start to cut open the abdomen. The surgeon will use a scalpel to cut through the skin layer, subcutaneous fat layer, anterior rectus abdominis muscle sheath, rectus abdominis muscle layer, wall layer, and peritoneal layer. Then the doctor will carefully cut open the uterus and use a special tool to gently pierce the amniotic cavity and suck out the amniotic fluid. At this point, the baby can be clearly seen through the incision. But now is not the time to celebrate. To prevent the amniotic fluid from affecting the baby, it is necessary to gently reach into the uterus and remove the fetus through the incision. The umbilical cord connecting the mother to the fetus is then cut, and the placenta is removed from the mother's body to make sure that the placenta and membranes are intact. Finally, the uterus and multiple incisions are closed. Thus, you are born into a new world with unlimited possibilities for the future. You can't imagine the indelible cut your mom took on her stomach to give birth to you. Although the operation lasted only 30 to 60 minutes, but the pain is as bad as breaking 10 ribs. Did you think it would end here? As you grow up, the scar on your mom's stomach will only get thinner with time, and eventually turn into skin color. This indelible scar remains on your mom's belly forever. Do you still fight with your mom when you watch this?